you see trends in, hey, these strategies, this pieces of information presented this way really seem to be more effective, regardless of, it's an omni-channel thing. It's just when you talk to participants this way, when you present trials in this way, it works better. Do you see those kinds of trends, or is it really much more diversified than that?
Absolutely, we see those trends. Yeah, and the number one area we see them is in the online self-assessment. So if you think about the stages of going into a clinical study or enrolling, first is, how did you find out? You found out through a mailer, you found out through an email, you found out through a digital ad, your physician talked to you. Step two is you learn something on a web property. You go to a web property, we call that a landing page, and it's a nice visual experience, but it's also an educational component to explain what the study's trying to do.
I've made them.
And then there's I want to see if I qualify. And then that's the online self-assessment, the 5 or 10 questions, sometimes it gets more, hopefully not, that help kind of determine eligibility at a basic level. Those questions are the number one area where we get a lot of rich data on common places that patients get tripped up. It comes down to the educational level of the sentencing you're using. We tend to be overly scientific in our industry. That probably doesn't surprise anybody with our words and our terminology. We tend to ask questions that are not clear. We just went through this with a recent Parkinson's study, and